everyone, to another session with the McGill Office for Science and Society. And joining me today, my colleague Jonathan Jerry, Emily Shore, and our special guest, the Globe and Mail's national health reporter, Carly Weeks. And we normally label this program as COVID-19 plus more. And sometimes we get around to the plus more, but because of the tsunami of information that floods us on a daily basis about COVID, we normally spend most of our time talking about that. And with that little intro, let me get to Carly, because Carly is at the forefront of the tsunami. And she was just telling us that this year she has written just a couple of articles that are not COVID. So, Carly, let's get going with how your life as a reporter has changed since COVID-19 has appeared on the scene.
Oh, yeah, it's dramatically different. And for us, it really started early in January. We started to hear reports about this, infectious disease out of China, all of these sort of mystery reports. And I remember the day, I think it was January 22nd, the World Health Organization confirmed that there's human-to-human transmission of this virus. And that was a really big day, even though we kind of already knew that this virus was spreading a lot. And now there's a lot of controversy about just how much China knew when in 2019. But in terms of from a journalistic perspective, the world really changed that day. And it's been nonstop ever since. Literally, it's taken over the newsroom. The entire Globe and Mail office, and I'm sure most newsrooms across the country can attest to this. Teams of reporters that would normally be covering things like real estate and business and education were all of a sudden on the COVID beat. It wasn't just the health reporters at the forefront. It was everybody, looking at every possible impact that this virus was having on us. And from a health reporter's perspective, life has certainly, changed, and it's changed for everybody. But it's really made for such a great challenge, because there's so much information coming out. There's so much news that's happening, so many, articles that are being published by researchers around the world, things that aren't being peer-reviewed, and things that may or may not be accurate. And so it's also really created new challenges in terms of how we're reporting, what we're supposed to be saying, how do you get the right information out. So it's been a really, really wild ride, and it's unlike anything. We were talking as a group, people who've been in this field, like I've been doing health reporting for over a decade, and people who've been doing it even much, much longer than myself say, like, it's really unprecedented. And it's hard to even compare it to things like SARS. It's because it's just so all-encompassing.
It is, and I must say I've never seen anything like this in my 40 years of being in this business, of where you are dealing with a virus that probably jumped from an animal to humans, which is so contagious. We've never seen this degree of contagion before, where there's so much mystery about exactly how the virus is transmitted, where there's so much confusion about the treatments. And of course, this opens the door to all the pseudoscience that rushes in. And this is for us at least, this is the huge challenge of how to deal with this. And so I'd like to start off with something that happened within the last 2 days, which I'm sure you've been dealing with, are these doctors who paraded in front of the Supreme Court in the US, all dressed up in white lab coats, claiming that there's this vast conspiracy of making us, wear masks and not using hydroxychloroquine, which is the answer because there's a cure. And there were several spokespeople for these doctors. One who was really intriguing, and Stu, I think we can put up the picture here of these doctors in front of the Supreme Court. This lady, who is also a preacher, and she I mean, has so many skeletons in her closet that, I mean, there's a whole cemetery in that closet. And she has made popular this expression, demon seed, that people who have gynecological problems is because in their dreams they had sex with demons and all of this. And she has also now threatened that unless Facebook restores all of her stuff, that God is going to come down and smite Facebook. I mean, just incredible stuff. But what is incredible about it is that it's not incredible to so many people out there who buy into this. So I don't know if you've dealt with this, or you're going to write something about this. I mean, it is such a mind-boggling scene that we saw there, and they followed it up yesterday because many of their posts were taken down, and they now followed it up with another assembly saying that they have the right to exercise free speech and whatever, and Facebook and Instagram and all of this are basically against free speech.
Mm-hmm. That's a really great point. Yeah, I mean, I think that this is an ongoing challenge that all newsrooms have to face. I've done a lot of reporting on, how misinformation is being used by, the anti-vaccination movement and things like that to sow doubt. This is like that on steroids because everybody has such a vested interest in the pandemic, and people are so tuned in. And I found I've never sort of seen an area where misinformation has actually been able to spread sort of this much through the mainstream in a sense. I mean, this example that you raise, I think a lot of people realize how ridiculous some of these claims sound. But at the same time, I'm sure all of us in our own personal networks, you log onto Facebook or any of these channels, and you'll see people who you legitimately think, they know what they're talking about. These aren't fringe people, and they are raising doubts about, the veracity. Is this virus real? Is this a conspiracy? And so for whatever reason, and I think it's because perhaps it is sort of so new and scary, there is a tendency now more than ever for people to look for theories that are completely bogus or, that kind of makes it more palatable. It's easier to sort of explain it away and say that this is a big pharma conspiracy or that we have a cure and it's just being kept from us than the reality, which is that we don't know a lot about this virus and we're still trying to figure it out. We may not have a vaccine, and
what is confusing here is when you see people in white lab coats who are legitimate physicians. I mean, they have proper degrees and all of that. It's different from someone like Madonna, retweeting this or Trump retweeting it. You don't pay all that much attention to that. But when you have people who kind of sound legitimate, so let me bring Jonathan in here because we've looked at this often. What do you think, Jonathan, that these people who are scientifically trained, what is the motivation here? Because when you look at the data about hydroxychloroquine, it's clear. There have been so many studies. There was one study that just came out a couple of days ago from Brazil. And Brazil is, of course, a hotbed now of this. And this study in New England Journal, this was a proper randomized trial with hundreds of people, some getting hydroxychloroquine, some getting hydroxychloroquine plus the antibiotic, azithromycin, and some getting just the ordinary treatment. And it was so clear that there was no benefit from the hydroxychloroquine. And of course, there's many studies like this. So Jonathan, what do you think? I mean, here we have doctors who supposedly read the scientific literature, and here they are sending a message to the public dressed in their white lab coats. I'm surprised they didn't have a stethoscope around their neck. What do you think motivates them?
Well, I mean, I'm not inside their head, so I can only speculate. But I mean, what I'm seeing are things that we've known in the skeptical movement for a while, that psychologists have known about for a while. I think, for example, of the book "Thinking Fast and Slow" by Daniel Kahneman, where his work with his work partner basically established that there's no such thing as a rational consumer. This idea that economists had for a very long time, that us as consumers, we make rational decisions, wasn't actually true. We're biased in so many different ways. Our brain is not a computer. And I think the same thing is happening with a lot of doctors. I mean, we kind of forget that doctors are not really scientists. I mean, it really depends on how you want to define scientists, but many doctors don't do research. So they're given all this knowledge, but they may not always be taught how to think rationally, how to really evaluate critically scientific evidence. And so they might be biased in some ways, especially if you start at the beginning of this pandemic and you jump onto this hydroxychloroquine bandwagon for one reason or another. There were some anecdotes and some preliminary evidence, and then you may take this and because you've spoken in favor of this publicly, you don't want to lose face, and so you double down. And so just because you're wearing a lab coat does not make you a rational person. You may have some great knowledge about your specific area of medicine, but it doesn't mean that you're actually very rational and critical about how you evaluate scientific evidence.
Yeah, that's absolutely true. And often the real evidence is tough to communicate. And Carly, I'm sure that you will agree with this, is, when we look at a scientific study, like the one published, I just mentioned in New England Journal, and you read through it. I mean, there's a lot of detail, the sort of the truth is in between the lines, and it's very hard to communicate this because, for example, there was that study about hydroxychloroquine, again, that was much trumpeted from Detroit, from the assembly of hospitals known as the Ford hospitals, where they suggested that they actually had some positive results. But when you really look at the study, you see that it really wasn't a randomized study, observational study. And the ones who benefited were much younger people. And also there was a big distinction between the black population and the white population in this study. So there are all kinds of confounders, but that gets lost when, someone just makes a sort of a blanket headline. So, do you find that this is a problem with the headlines, and maybe even with some of your articles that because you probably don't do the headlines, right? Just like I don't do the headlines for the Gazette. I don't know what the headline is going to be until the column comes out, and I've had issues before with this. So have you had anything, that kind of thing? Is that maybe what you say in the column isn't exactly what the headline implies?
That has been an issue in the past. We've been really careful around our reporting with with COVID. I do think there's probably a couple of instances where the headline didn't exactly reflect the tone of the article or what the article was saying. And, I can't think of an example where I wrote something where, in this instance, where the Globe put a headline on saying breakthrough drug or, miracle for COVID. But I've seen a lot of that at other publications, even in recent weeks. Like we see a vaccine trial come out and it looks positive, and we all of a sudden it's being called a breakthrough, or we're hearing that vaccine for Christmas. That was some big headlines in the UK. A couple of weeks ago, when the Oxford results came out, and it's definitely irresponsible. And that's when people come back to the media and say, well, it's your fault. You guys are, making all of this up, and you're pushing this agenda and all of this. And it's, and it does a disservice to the public, because we're trying our best to get the best information out at a time when there's just a fire hose of everything from credible information to complete nonsense. And so it is very difficult on an ongoing basis to even try and parse through what are the stories of the day that we should be covering, and how much weight do you give a news study? I think aerosol transmission has become one of these issues that it's not quite as salacious as, this what happened this week with these doctors. But there's been so much misinformation spread about aerosol transmission of the virus. And there's basically a movement of people who are, spreading misinformation on the internet that this virus is truly airborne, in that, it will suspend in the air for hours, like the measles virus, and that doctors and governments are trying to cover this up. And so I think it's really damaging, because it's all of it seems designed to damage public trust in institutions, and I'll tweet something about aerosol transmission versus droplet transmission. And, you get so many bots and trolls writing to you. And it just shows you there's so much vested interest in, just basically destroying public trust, sowing this discord. And it's really problematic.
Well, of course, people don't understand the difference between aerosol and airborne, right? Well, of course, it's airborne. I mean, we're not secreting this through the soles of our feet or through our hands. Of course, it's airborne. It's coming out of our nose and of our mouth. But there's a big difference between droplets and big difference between the size of the droplets and what happens when all the moisture evaporates and you have just the viral particle, I mean, and these are not such easy things to talk about, because it's very hard to do the relevant experiment, because you can't really do human experiments, right, to see how people are going to get infected. So there's always the but and the what if. And, we just don't have the concrete answers to this. I give you an example. I just got an email just before we started. I got an email from a lady who's a teacher. And of course, she's worried about going back to school. And she says she has to deal with all kinds of papers that are being sent to her by parents who have to sign things, and the papers that she gets from the school administration. And she's worried about physically handling the papers, because she's handling dozens of papers every day. So, she's concerned about whether or not the virus can be transmitted like this. Now, the problem that I have with this, and I think probably most people in this field have, is that you cannot give 100% definitive answer, because there's so much that we don't know. Yeah, in theory, the virus can survive on that paper, and if somehow you have an infective dose on the paper, which is hard to imagine that you'd have, but if you do, and you touch the paper, you touch your face, I mean, in theory, it's possible. But I think that this is such a small risk that, if you're going to guide your life by worrying about every piece of paper that you touch, you're not going to have a life left. So I mean, you have to kind of categorize your risks that you're willing to accept.
Or at the beginning, like in mid-March, I mean, Joe, you also did a bunch of interviews. We were talking about what surfaces, what receipts, paper versus hard counter. So it is hard for the layperson, the public, to kind of evolve once the science evolves as well, right? So now we're not really, well, we are in fear of COVID, but we're not under lockdown. And the new kind of shift is how to coexist with COVID, right? So it is about handling the papers, because we know now that that's less of a transmission there, right? It's also about, having the 50 people indoors. But again, you're still supposed to be socially distant from, if it's not your little cluster. But how do we really want to have them indoors still? Are we just going to sit on separate couches? I mean, how can we formulate it in our minds? So some people would say, no, never mind. I don't even want to go there. They'll stay outside like before. But then how are you coexisting with COVID? We could be a year.
I mean, this is going to have all kinds of social consequences, right? I mean, the working from home, which at first I think may be attractive to a lot of people.
Right.
You don't have to go to work in the morning, and you can sit there in your pajamas all day and work. But I think eventually you're going to find out that this is not the way that you want to live. I think that is going to have a big impact on society. So, Carly, you've been working from home, right? And all your colleagues are working.
Yeah.
How do you?
Yeah.
I mean, is this what you want to do for the rest of your life?
I was actually having this conversation earlier today with my husband, about because we were driving around downtown Toronto, and you're starting to see people sort of getting back. I saw a guy in a suit, and I said, wow, like, look at that. I haven't seen a man walking around in a suit in months and months.
Such a novel.
So you are starting to, yeah, that's right. But you are starting to see a little bit of that creep back into, the normalcy of it. I think that what we'll eventually see is that there will be a lot more of a balance. There's going to be workplaces that will say, yeah, stay home forever. The Globe and Mail, for instance, is not looking at that. We're not doing perma work from home, but I think a lot of people will just embrace some of the flexibility. So some people might want to go back to the office full time. Before the pandemic hit, I was working a combination, working from home, working from the office, and it was perfect. And I think that we'll keep probably going with that. Like I don't anticipate any big change. And I think that if anything, as I'm sure we'll talk about this, second wave that's coming, we may see ourselves back in sort of a lockdown position. But I think in a lot of ways, it's, for those who are able to work from home, there have been some upsides, but there has been a lot of downsides for people too. And, I think we're just going to start hearing more and more about some of the collateral damage, some of the people whose surgeries have been delayed and some of the consequences they face from a health perspective, the mental health perspective of isolation and how difficult it is for some people to be on their own. Like some, people who, whether they're living alone or they're raising kids on their own, or, even if they're in sort of a family unit, it can be very stressful. That's what we were dealing with, like my husband and I with our son. It's really hard to work from home with others there. So I think that all of us have sort of a reckoning that's coming, and how we're all going to deal with that. And I just wanted to come back to one of the points that Joe made earlier, though, too, when we were talking about COVID and the evidence and how everything is still, evolving and changing. One of the things that just keeps coming back again and again is that people they want really simple answers. They want this to be simple. And that's why I think it's so challenging to get some of this scientific information out or some of the nuance out, because that doesn't translate well on, social media or in a headline. And so the tendency, I think what we see more and more, and I'd love to get your guys, take on this, is that, some doctor who's completely biased or out to lunch, or someone who just has this viral platform can say whatever they want. They can say that, a couple of months ago, there was this, vitamin D is the cure. If you have just take some vitamin D, that's going to cure COVID, and that came up. And these things, just the public latches onto them because it's easy to digest, it's understandable, and yes, that makes sense to me, as opposed to this scary, well, we're not quite sure, we're going to look at it, and here's a whole lot of nuance that's really hard to translate. And I think that's where we're at right now, where it is this push and pull where, there's good scientists and good researchers who are doing the work, but it's being undermined because, if Theresa Tam, for instance, changes her stance on masks, well, now she's, an actor for Chinese officials. And, as opposed to someone who's basically evolving as the science evolves. Now, that's not to say our official response in Canada has been 100% great, but it's just, anyway, this tension that we face, it's not going anywhere, and it could just keep getting worse.
Of course, you bring up a very important point. Science evolves, right? Science is not capable of providing a definitive answer. So, this notion that way back in March, many people, including Dr. Fauci, were saying that, masks may not be the answer. Well, at that time, based on the evidence that we had, that was the conclusion. But as we get more and more studies and more observations, things change. And I don't think anyone is saying that masks are the end all. But I think we've got to try, because nothing else is working. I mean, here in Quebec, we're seeing roughly the same number of new cases every day. So we've got to try something. We've been social distancing for a while. It hasn't really cut it. So we've got to try the masks. And then, of course, there are people who say, well, yeah, but then not only you interfering with my freedom, but I'm not breathing enough oxygen. I'm exhaling too much CO2. I have to re-inhale that. I mean, this is the kind of stuff that you can dismiss because we know the studies. Studies have been done with oximeters on the finger and, the mask on, and that there's no decrease in oxygen. Now, of course, it's not comfortable to be wearing the mask. That, of course, is true. But we got to give this a shot. Something else I want to bring up at this point, thinking about the masks, and this is a horrific thing that came out, I think, just yesterday. People are making all kinds of masks with all kinds of designs. But there's this one guy who's now selling masks with images of the Holocaust on there, which is an atrocity. And of course, the image or the message that he's sending is that we're looking at the same kind of situation as the Holocaust, where people are following orders and just blindly, like the Germans, of course, claimed that they were just following orders, and that we're looking here at a Holocaust where the government is telling you to wear masks, and who knows what they're going to do next. And the story is now starting to spread, but this guy is defending his action. He's saying that yes, we're facing a catastrophe here, and the government interfering and telling us what to do, and our freedoms are being taken away. And he's using the Holocaust as as an example. Now, how do you fight this kind of stuff?
Oh, that is, it's awful. And we've seen this before also with the anti-vaccination movement. There was one of their infamous anti-vaxxers, I think Del Bigtree, who was wearing a yellow star, that basically comparing the persecution of Jews in the Holocaust to what people in the anti-vaccination movement face now. And the question of how you combat it is so fraught. I actually think it's not that complicated, but for whatever reason, we're not really seeing a huge investment in it. So, it used to be, from a news perspective, I still remember, like, I was in the newsroom when I was told to call up an anti-vaxxer to get the other side of the story. It was a story about vaccines. We'll go call someone who doesn't believe in them. That wouldn't happen today. Things have evolved, at least in that sense. But there's still a lot of mistakes that get made by mainstream media when it comes to covering things like vaccines. And so, of course, there's a lot of mistakes being made when we're still covering things like, anti-masks. A couple of weeks ago, there were anti-mask protests, and a lot of the Toronto media just simply put up pictures of the anti-mask people with their signs. And here's a bunch of anti-maskers saying that masks will kill them and they can't breathe, and just repeating the claims. And that, we know in itself is just, that's 101. Don't do that, because as soon as you repeat the claim, you're then putting that in someone's head. Even though you're trying to say, no, this claim is false, what people are hearing is the claim itself, that this false claim that masks are somehow depriving people of oxygen. I think that journalists need to get a little bit more savvy. Newsrooms need to invest more in countering misinformation. I think there are some people whose dedicated beat, we're seeing more and more beats dedicated just to misinformation. And I think we need more of that. And from the social media side, there's been so much controversy over what Facebook, for instance, has and has not done. They make so much money from the spreading of these viral videos. And it's so distressing to see what kind of engagement they get. Some of the highest, there's been some really good New York Times reporting on this, some of the highest engagement videos on Facebook, millions and millions of hits, are completely bogus, videos about the pandemic, which we've seen more of this week. And, there needs to be accountability there. And it's something that has been, people on both sides of the border are pushing for. But until there is a big change there, I think this problem continues. Even if journalists like myself and others kind of up our game, we can only do so much when you're up against, 10 million views of a viral video on Facebook.
Yeah, this is one of the problems, is that we end up preaching to the converted. And unfortunately, I think that's kind of what we're doing right now, because I know that the people who are watching us are, sort of our followers, and then hopefully fans, It's not the Del Bigtrees of the world who are watching us. And I know Jonathan is an expert in Del Bigtree.
But Jonathan also says, and he often says, as do you, Joe, that it's not the outliers on the other extreme that these videos are going to reach. And I think also, especially, there's like that vaccine hesitant population, which is somewhere in the middle. And I'm going to, I guess, maybe use that for even COVID hesitant, just in some way of, I think that is even a larger group, because I'm certainly not vaccine hesitant and I'm pro-vaccine, but I think that we mentioned this a few weeks ago as well, or I did, that there's really a lot of uncertainty in this time. And so there are still people who are pro-science and everything, but might be a little hesitant.
Of course there is. Yeah. And in this case, the vaccine hesitancy has some legitimacy, because the research is being rushed without a doubt. And, whereas before it took 10 to 20 years to put a vaccine on the market, now understandably, it is all being rushed. So of course there is some legitimate concern here, and I have an issue about the media. I think being more optimistic about the advent of a vaccine than the science can back up. And we're seeing all of these articles about we're going to have a vaccine by November or whatever. Well, we may have a vaccine, but that doesn't mean we know that this works. That is going to take 2 to 3 years until we have an idea whether a vaccine that is being used on a large scale, whether or not it works or not. So just this idea that there will be a vaccine available, that's not the solution to the problem. And people think that somehow this thing is going to magically go away when we have a vaccine available. It's not going to happen. First of all, we have the problem. 20 to 30% of the population now says that they will not subject themselves to the vaccine no matter what, because they're just too fearful. And then even if we have a vaccine that works, vaccines don't work 100% of the time. The coronavirus vaccines, like the flu vaccine, you're happy if it works 70% of the time. So you're talking about 70% plus subtract the 20% who are not going to take the vaccine. We don't have a solution to the problem. So Carly, what do you think about this, about the optimism that is being expressed often by the mainstream media?
Yeah.
Yeah, you're absolutely right. And I think the media does need to be called out more on this, and we need to improve our reporting. There's a really great Canadian journalist who working in the States for Stat News, Helen Branswell, and she's been doing some of the best reporting on the pandemic since the beginning, and she's covered the infectious diseases beat for years and years. So, I look to people like her to help guide, sort of the way I'm thinking about vaccine coverage, because they're very measured, and, Stat News has faced its own criticism for its, ties to pharma and things like that. Sure. But they have done a really good job of tempering a lot of that optimism. And I don't think that's one of the few publications out there that has. It is great that we have all this research that's going on. We've got, all of these trials and positive results and all of those other things. But I think, yes, the message that is not getting through very clearly, and we need to do a better job because it has real repercussions, is that the vaccine is not some magic bullet. If by some miracle we get a vaccine in the next 12 months that's ready for public use, we're still going to be dealing with the coronavirus in one way or another. And, we've gone sort of from thinking we have no idea what this virus is to, okay, this is going to be around for a while, to, I think this is what scientists have been saying now for weeks and months. This is basically now part of our world, and so how do we figure out how to live with it? So is it more about, do we need to focus more on treatments? And this idea of just focusing so much on a vaccine, I think has done a lot more harm than good, because people are just now waiting for that. As soon as we get the vaccine, we're all back in the office, everything's back to normal, life can resume. And meanwhile, and so we have a situation where, the provinces are opening up. We're seeing resurgences of cases in certain pockets of the country, like BC and Alberta, that had things under control. And people are saying, well, what's happened? What's going on? And, it's I think we need to be doing a better job of basically saying, this is the way life's going to be for a while, and how we live with it. We can't just sort of wait for that vaccine. We have to maybe get better policies now to keep things under control. So yes, I've certainly, and I was one of the early ones who thought, well, yes, this vaccine is going to save us. And now I think it's not. It's going to help us, if anything.
Well,
if we get one.
When I think
right?
back,
if we get it.
When I think back to mid-March, I mean, there's been all this focus on the vaccine, because when this happened, in the span of the WHO declared it a pandemic, I think it was a Wednesday. It was that 4-hour period where the NBA was canceled, Trump did his address, the WHO declared, and Tom Hanks and Rita Wilson got COVID, right? It was like all of a sudden crazy. And I think then vaccine, then it launched. And I actually thought, oh my gosh, more people are going to become pro-vaccine because of this. This is what the world looks like without a vaccine. And no, I mean, that's not what happened. And then time came on. And I think that's where that vaccine focus, because it was just totally out of fear, right? And the days went on and we knew more.
So Carly, let me ask you this, because you've been living and breathing this now for months, like, most of us have. What changes did you make in your in your life? Like, what are you really careful with? Because you're dealing with this onslaught of information all the time. You're absorbing it. What effect has it had
on sort of me as a person?
Yeah.
Yeah. Well, I'm also pregnant, so I'm due in a couple weeks. So yeah, so
you're due in a couple weeks. Oh, so
yes,
you're gonna have a COVID baby, kind of.
Yeah, pandemic baby. But we're I feel like it's actually a really great time right now to have a baby, as opposed to March, when everything was just getting going and there's a lot of fear. So then that kind of reflects how things have changed for me. And so as a health reporter, I'm always that person that's like, well, how much sodium is in this? Or, especially, things like feeding my son, making sure, and then we don't have a lot of screen time. And actually we had no screen time before COVID hit. So it's changed literally everything. I mean, now, so we in our house were being very careful, simply because even though we know that a lot of pregnant women fare well, there's some research saying that they could face higher risks. So we're erring very much on the side of caution. And we're still living like, between a stage 1 and stage 2 life, maybe hitting a patio here and there. But yeah, like my immediate family doesn't live in Toronto, so I haven't seen them since December. I saw my sister in March, the week before all of this happened, and we may see some family this year, we may not, and we're seeing my husband's parents from a distance. I went from wiping down groceries to washing hands obsessively to now saying, okay, we don't probably need to do that, but we're still going to focus on, we wash hands now all the time when we come in, and my son's gotten into that routine. And, unmasking, he really enjoys. He's 3. He loves wearing his little mask. Sometimes he won't take it off. He gets very angry if you try and take it off. So there's, some hope to get some kids on board with masking as well. And then, but really, I think from sort of that more of that social perspective, we're still very much living in a bit of a bubble, where we're trying to enjoy things. We rented a cottage a few weeks ago, wiped everything down when we got in just to be extra cautious. But, again, seeing people from a distance in a park here and there. And other than that, it's, we're sort of still, I would say sort of in that 70% of a lockdown mode, but allowing ourselves some of that freedom, taking walks and going outside and maybe trying to go out of town in a safe zone. We're not getting on an airplane and flying across the country because that's just too risky.
And I think you're not inhaling any essential oils to kill the virus in your nose.
Definitely not. No. Yeah. So many people have been, sorry, Emily, so many people have said, buy this UV wand and disinfect, your house. And I'm like, none of this stuff is really necessary. I mean, maybe if you operate a store, wash your hands.
One item that was, I was made aware of yesterday was a doormat, which is laced with copper fiber. And of course, the idea is that copper has the antiviral activity. And well, what about taking off your shoes when you come into the house? I mean, this doormat is just nonsense. First of all, although it's true that, copper has antimicrobial properties, but there's the contact time. So unless you're willing to stand on that doormat for 15 minutes or whatever to activate the copper, it's total nonsense. But I'm sure it sells. People say, oh, yeah, well, I don't want anyone trekking the virus into my house, which in theory is possible. But there's a simple solution. You take off your shoes, as you should anyway. And I referred to the essential oils before. I mean, this is a big deal out there. There are a lot of people who are doing this. Numerous different kinds of essential oil, from lavender to extracts of plants you never heard of. And always the idea is that this has the ability of inactivating the virus. And they will refer you to some study, which of course showed that, yes, when you expose the virus in a Petri dish to some huge dose of this plant extract, it will, the virus will be inactivated, as it would be with concentrated sulfuric acid, or I suspect with urine. But it's a meaningless kind of study. And yet, that's what they refer to. It's a strange world. Anyway, Jonathan, let's get back to some of the stuff that you've been looking at, because I mentioned before Del Bigtree, who's just huge out there in the anti-vax movement. Are you seeing any trend at all in the anti-vaxxers coming around, or it's just that they're getting even a bigger shovel and digging a deeper hole?
I mean, I would be lying if I said I have my finger on the pulse of the anti-vaccine movement, but I mean, from what I've seen, it's just there's been this big ball of conspiracy ideation involving anti-vaxxers and far-right people, a lot of libertarians in the United States. And this big ball is just like a snowball that is just going down and gaining in mass. And of course, the impact that this is having on regular people who may not, care about these things, is that all of this misinformation gets spread into the social media landscape. And you see things from your friends on Facebook who send you these things. And so you may not even know who Del Bigtree is, but you will hear about some of these conspiracies. There was a great bit of journalism, I guess, from NewsGuard, where they listed the super spreaders of COVID-19 misinformation. And at the top of the list was Rush Limbaugh. And then there were some major figures, some major pages on social media that have a huge number of followers. And then these people take the content that they create and they spread it through their own networks. And so you end up on the receiving end of this stuff. And so, as you were mentioning with the polling data on vaccine sort of acceptance in the face of a potential COVID-19 vaccine, I'm really worried about what all of this is doing, trickling down through social media to the general public's emotions, feelings vis-a-vis of a potential vaccine. I think it's creating a lot of anxiety and thoughts of, well, I don't know, I've heard that maybe it sounds really risky, maybe I won't do it, and that's going to have some real life consequences for public health.
Well, we used to rely on mainstream media, on newspapers, network television, etc., for the news. These days, most people rely on social media. And of course, mostly unpoliced, although they're trying. It was very, very interesting yesterday, this hearing in the U.S. in front of Congress of all the major CEOs of Google, Facebook, Instagram, Amazon, that they have too much influence, over what people think. It's fascinating business, 10 years ago, this would have been unthinkable to have these people testify in front of a Congress about basically having a monopoly over information, right?
Yeah.
I mean, it is a legitimate concern, right? I mean, Carly, what do you think? I mean, people now, instead of going to the Globe and Mail website or the Gazette website, are going on Instagram or, following someone on Facebook who may or may not have the proper credentials.
Oh yeah, it's.
Oh, sorry. Go ahead.
I just think it's scary, and I think it's one of the biggest problems media is facing in this decade, in this century. I mean, the intersection of truth versus misinformation is. We're at a massive crossroad here, and I don't think we've figured out from a society level, from a government perspective, how to police this, how to move forward. Because, as soon as you talk about policing Facebook or censoring posts or things like that, this is, you're infringing on freedom of speech, and this is a private company, and people can say whatever they want on these networks. But what we've seen with there are real consequences. There was the story of mothers that have gone on some of these anti-vax or natural sort of websites to connect with other parents to get advice. Don't take your kid in if they're really sick. Don't take them into the hospital. Just give them these vitamins. And there's real stories that have been documented in the media of kids dying because they're taking advice from some of these groups that are out there. I mean, the harms are real, but we don't seem prepared really to confront the reality of the problem, which is that this information is being allowed to spread. Facebook and Twitter and Instagram have done some things, to sort of limit the spread. So if you look up, anti-vax posts on Facebook, they're now harder to find, for instance. But they have so many different groups, and Facebook does have a big financial incentive to keep a lot of them going. And I say Facebook because that is where a lot of this stuff does originate from. And I think this is going to be one of the biggest problems we have to face, and we simply haven't done a good job yet.
Let me ask you this very quickly, Carly. Do you think that our public health authorities in Canada are ready to successfully address this wave of vaccine hesitancy in the age of COVID?
I don't. Nothing I've seen suggests that they are. Months ago we heard that Theresa Tam, the Chief Public Health Officer of Canada, they were working with some social scientists to try and get to the bottom of where some of these troll posts were coming from and some of this misinformation. But I haven't seen anything come out that really is different from what we've seen before, which is your generic sort of vaccines work, and here's the facts about COVID. And what we really need are really good campaigns and counter campaigns that push out good information, because people are susceptible to the messages that they hear. And so if you're on Facebook, maybe we're not going to fix the problems in that company, but we can also put out really strong messages, and so whatever government, if provincial or federal, can create a really compelling, amazing campaign that goes viral in and of itself, just spreading good information, because people will then share and click that. And, if we focus more on doing that, and I've talked to a lot of doctors about this as well. I think that doctors need to get on board and to start spreading these messages. I think a lot of people are hesitant and afraid to really speak up and get involved. They don't want to take on an anti-vaxxer. They don't want to take on an anti-masker or, people who don't believe that COVID is real. But you don't really have to engage with that segment. We know that there's a hardcore group, and they are the minority, but they're very vocal, and they get a lot of attention, who will say things that are completely untrue, that vaccines cause whatever, just to use that as the example, or that masks will, kill people. But there's so many people with so much good information at their fingertips who can just start to make their own campaigns. Here's what we know, and there's so many different ways to make them really compelling, and you get a team of people together to make these campaigns work and make them viral. I don't know why we're not doing more of that from sort of society.
We have to use some of the techniques that they use.
Yeah.
When you repeat something often enough, it kind of becomes true by repetition. When Trump says fake New York Times, fake news on CNN, and he said it all the time, people start to absorb this and say, well, maybe it's true. Maybe the New York Times, does have fake news. I mean, we got to be out there messaging the same way. We just keep repeating. We go by the evidence. We go by peer-reviewed papers. Yes, no, they're not always perfect. Let's face it, that notorious paper by Andrew Wakefield chastising vaccines appeared in The Lancet, but it is still the best way to go, the peer-reviewed study. And we go where the evidence takes us. And there are no conspiracies by pharmaceutical companies to undermine the health of the public. They would be happy to sell working drugs. That's how they would make their money. And we have to keep repeating this message that we're going by the evidence. And I think Dr. Fauci is having some success with this, because he doesn't attack the opposition. He just keeps saying, look, this is what the data shows. This is what we're going to go by. And I think we just have to keep repeating that message.
I have a question for Carly. With the Globe and Mail, has your reporting on COVID, has the oversight, changed, or your editor, just to make sure that what you're putting out there is good information? How do we know when we're looking at the Globe that what we're reading is correct or something like that?
Yeah, this is a great question. And, and I'm sure there's days where we've gotten it wrong. I know there are, of course. We have had more conversations around those issues, in the last couple of months than we probably have in the last couple of years, and basically there's like the team of reporters who covers health has a daily call where, we all sort of are weighing in on various issues, various topics, various studies that have come out. What did you think of this? And did you guys see that? And so we sort of have our own way to curate the news and to try and sort of figure out what's worth it and what's not. I think one thing that's become clear is that it's not a great idea to pay a lot of attention to a lot of the, the preprints that are coming out. There's so many articles that are being published by researchers that haven't really been peer reviewed or looked at by anybody else. And early on, some of them got so much attention and made so many headlines, and then they were retracted a few weeks later. So simple things like that, I think can help us up our game. But at the same time, it's sort of this constant dialogue and discussion that's going on, like where should we be placing our attention? Are we covering every aspect of this, in the right way? Do you want to be focusing on this, or is that giving sort of too much coverage to it? And I think from sort of the misinformation side of things, I think that we should and hopefully will see more reporting on that. But, there's so much actual sort of just news coming out every day that I think it's been a bit of a challenge to take on some of the fake news, and you have to also be very careful when you're debunking something, because you don't want to, again, just repeat the false claims, that, this group says falsely that vaccines cause whatever, as soon as you do that. So there's that challenge as well, is as soon as you bring it up, do you just make it worse? And I don't think you do. I think there's a responsible way that you can report on it. But I think that we need to hopefully get into a phase, and I think we're getting there now, where we have a bit more time to sit back and reflect and say, here's some information that will hopefully help people. I go back to aerosol versus droplet. I got the chance to write an article about it a few weeks ago that I had a ton of feedback on. It sounds like such a dry, boring topic, and it can be, but really, people are desperate for good information, So is this spread by droplets, or is it aerosol? What does airborne mean? And just that article, I think, hit such a nerve with people, because they just want good information and they just want reliable information. And so hopefully we can provide more of that as this goes on.
Well, you brought up a very important point about retractions and making corrections. And science, of course, is a self-correcting discipline. Yes, there are errors that are made, but they are corrected. And this is something that we don't see at all in the pseudoscience area. They keep messaging exactly the same thing. There was a study that came out. This was a few weeks ago about hydroxychloroquine, which was much trumpeted because it showed that it was ineffective. And the study was retracted after, because it turned out that they hadn't gathered the information in a proper way. So science will do that. When there's a mistake, yes, we make the correction. And I think this is also a message that has to go out, that science will never have the final answer. We keep massaging, the data and seeing what eventually we can squeeze out of it. Unfortunately, we're out of time. That's been a great conversation, Carly, and best of luck to you with the pregnancy. I hope that there was no demon seed involved here, right?
Definitely not. No.
We'll check back with you sometime after you have given birth to see the new changes in your life, because even under the best of situations, it's a life-changing event, right? Never mind giving birth under the COVID situation. So thanks a lot for guesting, and thanks to Emily, thanks to Jonathan, and thanks to Stuart McCombie, who put it all together behind the scenes. And we'll be back with you in 2 weeks' time. In 2 weeks' time. And our guest then is, Emily?
Dr. John Brownstein. We'll have lots of interesting things to share. Okay.
So thanks for everyone who's tuned in. Thanks again, Carly. And we'll see you
soon.
2 weeks.
Thank you, Carly.
Thank you.
Bye.
Bye. Thanks.